who is a preterm and the classification your castle will be a premature birth and who is a preterm baby and the classification anything.
Okay. Into your cat preterm. Well, a tree castle, your castle will be a yawan and tem dodo.
Number in the town answer.
Until usually I make it jovial statements or more pre and on my bantem
and on my bantem
anti preterm or my pre abantem. Into Acrobia wabantem too early, and I say waba too early no near castle a preterm near sure or bad days more. Pregnancy be I was say you to me carrying for 40 weeks. 40 weeks. Into
40 weeks, which is 9 months.
Yeah, into your you cut term, you can 37 completed weeks to 42 completed weeks. Until I cry a woman within an answer or what or my medium within that 37 completed weeks. Now watching Edria San and son because see now watching Edria 9 million. Say or me 10 babies. Now Obibia you will before that time no. You can say oh you preterm. Now preterm for no. You will move a hodro because you're sure a bit more. I want them was so simple.
Me answer never classification. Me, I'm trying to catch the organ. When you say I'm more tired, so you terms a bit to say, trimester, first trimester, second trimester, and the final trimester is the third trimester. I cry a wound within the last trimester, no, the third one. And no into your preterm. That's 7 weeks now. Can and a war the last trimester.
The last trimester.
Into a one with your one year preterm.
You beat me out in the last trimester, but obey
preterm. Okay. And now you mean your preterm and happening within the second. First one, you said that
yes.
But second trimester, it's in your beams. And that's what the woman was a good trevor. I said there was
the Monzani would into your
classification, maybe a baby. Hey, second, you need trimester, the body anyway. If I'm of classification,
okay. Into CFA classification, you were late preterm. The late preterm for near more or 35 weeks. You could see 36 weeks.
Yeah, no. Weeks and almost 9 months. Until the word you can say the word 8 months and as baby Sana may show some for being
okay. Yeah. We use more of the weeks, you know. Yeah, the now watching a year classification.
Okay.
Until you're more a late preterm, and you're moderate. Moderate near more money 32 weeks, equals 34 weeks.
Okay.
Only a moderate preterm. And now Obibia or less than 32, no early preterm. But mono your sub classification, you very preterm. Only 28 to 32 weeks.
Okay.
Until you share 28 weeks, 7 months, no. Till we are into 28 to 32 weeks near very preterm. And will be less than 28 weeks. Until I could be a one and son 7 months be an from extremely preterm. No, extreme, yes. And not the basic, the major classifications of preterm.
Okay. Young shirt is a now can into more preterm for I watch that come my say a wakan. Because in the first place, gestation, Sana Mokana, time non swing.
Yes.
Until I'm not expecting say naturally Obana Wobekano. And no so I cry minimum war prenos or coyunti. I have war spontaneous delivery, say, and
yes, it be a while who I wait me can't, but it be also because of some medical condition. Say, yeah, I'm sure you be losing my meaning. Now, was say, yeah, end the pregnancy.
Okay.
My men on hot ton.
Thank you. Asha, my member, I'll call baby. Asha, you shared the primary causes of premature birth causes in the area.
Okay, Pacho me that's a pa. You can't causes of preterm birth. The medical can say, preterm birth, it can happen to anybody. Irrespective of person. A bit me to nurses, doctors, obia dreadini, obia. Ain't was in public near the 2 year term. Say, a idea bit me to obia. Now, your shame ma a deba. ene ma na de ba ne de dɔɔso de di kan sɛ ɔba fa afura normally no bebre yewo ebi abofra baako but mpem bi on so ayetimi nya entafo awo enti sɛ onyim ɔba onyim na sɛ ɛyɛ ntafo ɛna wo career the likely enye 100% guaranteed to obewu preterm.
Okay.
But because say nkra ne ye mienu no ubetumi, so it's a risk factor. Say ubetumi awo preterm wa bra wo time on so. But eno nche say menyem ntafo bi a mewo preterm. Afi nso ye wo bibi to say infections.
Probability ne yesen.
Oh, me fan say be 50-50.
Okay.
Ebetimi aba say ubetimi awo preterm ana wo. Afi nso ye wo infections. Ye kan infections ye hwe say oba bia enyem free 1 month go see 9 months ni mo a obe nya ahoden e de ahwe abofra no na yare bia e ma nyinsen nim but sometimes it me ba say nyinsen ni mu no oba no betimi nya yare bi wo e infections e bi wo kra UTI urinary tract infection and now say even malaria ya ye hu ne say malaria kra no emi nyina betimi akose preterm birth nti na so oba wonye ma oba hospital ye labs ye routine labs ye hwe say mo bi ani umogem so infection bi wo honso so ani ye treat and that is why we always encourage say antenatal care no e ma ne bedi so de bia say de be ya ye hu esinto bia na ye si ano kwan aside that no ye wo bibia ha e friend no yare bia onyima nyinsen ni enam say onyim ni nti yare ni timi ba because of nyinsen na ya bofra na wabeto ye muninti ebi ti say ye wo bibi a friend gestational diabetes eno ne che say nyinsen na wonyim no
ka wonni asichi
yare ka wonni asichi ena akofa aba ana hypertension induced hypertension eno no enam say abofra na wo carry no ena etimi akofa sa yare na ba oso enti sa yare mienu yi eno so betimi akose preterm birth aside that no ebetimi anya uterine abnormality bi ebi wo ho no mo a uterine fibroids and also so problem with the uterus na mean so betimi akose preterm birth your lifestyle being so ebetimi akose preterm birth ebi wo ho no ma make ebi ono mo nsapa na so smoking
can be baby sapa say lifestyle so how obi ono mo substance abuse smoking
yes and also
oba emani bi twa bi pa
ebi num pa
mo ye ayi mame mbisa mo ayi mo oba bi aba mo hwe na wo twa mo blade pa like so you kaso bi twa bi blade na wo homi atum say
ye nyabi ye tan nyabi pa
yes am esa wo ye den
so de wadwuma na wo
nyabi na sa sha so ye kramoni wonnum sa na wo twa blade sa na ye
se ne madwuma na me ye nti me madwuma ne na me hwe
say yes
me wi amwa bi wo ho amede ama
no yes obi smoking na wo twa say you are partly smoking
oh yeah
and ya sha wa twa bi
anyway and I feel so bibi to say physical abuse ebetimi aba say oba onyem na bibi bi a wato form na bibi asi na moja etu no ebetimi ama we na so obi won so ye stress to anxiety edoso a we nyina ye risk factors a ebetumi e de preterm birth yinso so aba
may I say doc when you how does maternal health impact the risk of premature birth to say the I share can say saying very important say on be take antenatal no seriously sa maternal health hormone kasa no boa and I say beba say preterm na beba na say obo okra nka beba na nso say the otama na say yentia wa hospital nitimi how does sa maternal health na boa
okay nti the maternal health is very important say maame no ofa afura ehun hia say nnuane a obedi ye enu oba ANC e de be ma obenum no ye nti ni nyina e play a role nti say oye mada na ofefru na say unko ANC a ebia na condition bo ebia na okra wo condition bi dada ebia oye hypertensive ebia ye be kekura wa ngasa oye diabetic dada ebia won no before say obefa nyinsen no kra no undidi ye umpomensisi ye nti eno nso say ofafro na wa ma hospital ya ansho ni anya follow up eno nso ye eputi the baby at risk say obe 1 in 10 before say ne time obeso enti ende very important say as every mother unya fa frupe ude unya hu say wa me say o period pe obe ba hospital obe test ni hu say you yinsen na afi obeko nc ni ahwe ni pedua bibia hu say bibia ye fine and also boa prevent preterm births
na wo kan aduanem so ba no be didi ni ade anuane be pa no ba nyama so di na de hin na ni kwan so di looking at the kan
okay anuane a oba ofrefre so di ye anuane ye local foods e wo so di balanced diet generally balanced diet inti anuane a lot of fruits vegetables a lot of high protein diet because so oba ofrefre mabe nipa mienu udidi ma baby no udidi ma wankasa mu enti e wose onuane no eye well nourished e wose eye balanced said de be ya akra no so benya bi enti ye ka balanced diet and say carbohydrate one portion eye say amu say kenko ni portion kakra
ko di aduane bi ankasa pintin bi ada me mo za mo ta kan sa ne pa pintin bi ada me na zo di banche bi bi chef
oba say bi akosua fish vegetables tomatoes nyadoa kwensusa a lot of leafy vegetables ma iron ne sanium anti nyina oba de ntina ANC your friend will be routine drugs folic acid and iron supplements ne sanium because you say a pregnancy no ntina ANC e ma say no because ye ha na ebi mun didi ye nti hu hia say ye de sa supplements ne ka ANC say de be ya e beboa apofra na ma na nyini ye wo ye fun
me that's actually my member say no ka say just say a 50-50 chances of obia or infant say or carry twins between a preterm and I say we ye was situation obi nyem kwada me no or like or entafo ba kutimi ba preterm and I say omo ba preterm omo miru nyina na ba preterm me no modin ko nya na but so I want to know ye obi betimi anyem tafo ama ba akwa ba preterm no no dem so be clean e fiansa na
okay me that's it normally ne dey se ba ko ba dia omunyina e dey etwaso but in rare situations and also crowd e bia me sure say bia ye part of the world I bia ye experiences but in rare situations it can happen but it can be rare situations but mostly no say mother no cause at the crunty a baby neighbor no it's like I would na no be and say na me ka say twin gestation na nkasa ye high risk no enti more probably say baby ne eba one ni nua no
say kwa
ebedem ti omunyina beba
good mo hwe wa akra ni nyina betim dem question ba na na akua boatema ene abusanfo a mo hwe wa akra sunyane mo betim dia ba na London for no no say kwa me London for no de by pa omo ho no de say the pressure on him separate mo ho pa abruchi on ti ne mo famra mo questions mana manhia for no hide yembisa emfa emamo asha before me for no hwe ye wo any environmental or genetic factors it may affect preterm and as a premature birth bi on ma ujana san ko area hanka bibiansi ba area bi akwotenanti betimi ye wo genetic or environmental factors betimi affect preterm
yes me that's a pa I will answer this question based on the theme no krana ye day celebrated this year November month April month no shy I trust to say equitable care for every preterm said you will be say no it can be there can be environmental factors because we share the way and me mu initially na we share say lifestyle activities bi kura betimi ama obi awo preterm enti obi wo ho a obenyem 6 months ebia yemfa ne say ote ebia de chem so ha obi so benyem 6 months sa ebia wo village bi baby and nipa no betimi awo ntem eja de owo krom no no anaso say ebia sa nipa no wo a care na baby ni benya no de owo krom no e de no so benya no ye different so it's likely say ebia de owo krom no ebetimi a survive and now high chance of survival than the owo ebia village no the entire ye ka say ni say sometimes aduane kura ye bedi a problem. It will be a honor, said the doctor kind, and say Nipano on him, Nasa when ya good diet, our debedi, ama, when ya who day, at the age in same name, a crown, obit me, I want premature. Sounds so as a young fan say, baby, or one say, oh, near facilities, it be a hospital crowd, beko crown, accessibility, no, any ho, obi or honor my baby or one before beko antenatal, this is our travel. Baby and son were Timmy assessing antenatal care. So and only they likely say environment now woman it can determine. That is why this year theme the year emphasizing on equitable care. Said the beya say a bass me wo preterm na mete chroma kumasia se me wo a crebiasia meti mean so den. I will preterm I will not so betna. Sometimes to say the kind genetic obi or hono or history of sa preterm birth no because cervical incompetency. Obi or hono obeti me enya cervical incompetency and it said na wo de na no yemre enti obi o nyim bia na de se bia ya ka efie omka se ya chichire na wo de na no said the be anyensen ne be ko nanim but ebi wo kra na ya chichire a wo de na no awo timi ka no wa bra say ya ansane kra na de ebesi no enye nti ye ni option say ye be den ye be saniti ye wo ma bi wo hono mo a omo wo that's history no nti eno so it can play a factor and obi on so your family history obi our family history of preterm birth but normally no nsheda enye kesi bebre to say risk factors na ye bobo so where you find yourself who delivers you any the all show no enso betimi determine whether say preterm na ya wo no or betna say and say on tenase so that one too is there.
You heard the short-term consequences of preterm babies and the long-term consequences. I cry you wanna 7 months time now so. Yeah, na hunsun so no. Imprint na ya na te saying
yeah
na we nyini kakran so hunsam te saying
me da se pa ensusan so no ye said your kind no ye was short term and ye was long term and enunti kra na o hwa obi baby say adenti na ye to prematurity nko ya per month e dey kan ho asem because of especially long term complications no amofra ne be fam no the edi kan no short term complications na say problems a baby ne be fa no because a preterm birth no and as a preterm baby no on nyini nu pempenso a ye pese wonya ansa na ya wo no oba ni systems ni bebre e mature enti oba our problems bebre enti preterm child or feeding problems said you obedi di e asem the edi kan pokra ye home said ye be ya ne home ne kura begina eno so ye problem enti akra ya wo ne preterm otimi da ho no mo a obehome a o ho na ne refi se wo home ye frɛ bibi apnia nti wo ho abon se okokra obeka se oni ho aha but wo mu a otimi samba
ani ehunu ase de ebe ye din na wo yesa no be de na wo ye hu
enti eno na che say preterm mothers no more word no omo ya de and they are going through a whole lot of distress because you pass through all these phases ohu we nyina because sometimes they be omoko and we have to resuscitate them ni amom mframa kopim say omo be back obi won so a temperature regulation problems or hono mo na ne ho ayenu won say because say omo nyini sa no omo skin no you're very light.
Oh no, I want to show so ni po so e den
o. So temperature regulation problems. Enti omo no empempi no either say ye kangaroo mother care and also say ye de omo share incubator say mother ne nye fita. The kangaroo mother care say ye de ne to maame no boso na honam e ka honam say de be ya maame ni heat no ebe wo me baby ni up but sometimes mothers ni bi nso wo a ya na omo ehunfa wo mo nti in the absence of KMC no se father no kra wo ho ni ne kasa papa no na che so be ya ono so owo no fo kakra in between no fo ne the baby ni hye ho a onya sa heat nti they say papa fo no ya here advocacy bebre ama say bebre ba hospital kra they would want to do it
obeda ho na ordinary
yes ye be explain the procedure na che ne de akra na hye
no just oda ho na
ubetimi atina ho
ekra and whatsoever your stipulated duration be I was say otimi say me fan say akora no bae no odi na ato no ma for saying 2 hours for 6 hours.
So KMC ni ye continuous one ho. But in this case no say eye papa no ebia na ontimi nye continuous no nti ebetimi aye ne kakra bi kura 2 hours say de okan na mana na ansa na ye beye no kra no baby no so oxygen so na any therapy to say CPAP ne sa ne mana sometimes eye den but all other parts of the world that even baby no oxygen so ne CPAP they do it. Yes, they share because of the importance now omunya nti baby need there was short term problems bebre no say ye woman na say oni hospital eye MBU ananiku ma ya manage such problems na likely say baby no ye nya no, and that is why we are advocating say prematurity na nye case owa ebetimi atu bia
because kamba baby say de okika nyina de ase enye den akura anhwe obewu bi sei
debi sana eya na eye efiefo mamifo na nkasa kura na omuhu nkora na ya na initially na ya na hope enim nti ya na de bia na ye ni omukasa na ye ni omudi agrose de because it's not easy the short term problems ne de eno na maka mostly na ya na wo immediate time na ya wo mo no but long term no ye hwe no so na edoso ene no se de ye lo waka long term no ye hu ni sese nti no ena ye fight for because health workers now we've embraced prematurity and we are doing our best to make sure say akwala bia ye be wu ni bia no be survive first no Ghana ha ye wo nkra 28 weeks 6 months 7 months ebi wo kro mo survive but say no they are doing well because we share definition of abortion and as akwala ye fa ne say the time answer down soon.
No,
abortion ye wo mu 2 times. Ye wo de wawaye.
Okay.
De wawaye induced.
De waka se won pa akwara no. Na wa ba bia expect ana so odin do aka no.
Any ye was spontaneous no mostly preterm birth and it missing. To say no one eba.
More like miscarriage.
Miscarriage, yes.
Yen kan say kwa miscarriage no ni twini say wapon right.
Enti ka wo hwe Ghana ye definition for omo ye term as abortion na miscarriage na ye beka se nkura na ya wo mo below 28 weeks that is 7 months eba from ni nyina
omo ya isabia
enti ideally no omo no kra na ye befa ne say age of viability ankasa say wo se nkomo ho ye din a ye wo se ye kan omo ka nkura omo aso senka wo say yetimi ye bibi mo no mundruye but wo hwe ye records mu say ya enkra ni bi wa 26 weeks 25 weeks we are able to care for them omo ye fine na ye yi wo mo no makofie and we follow them up until we are doing well until ye best say short term no problems are yabobo so no want me manage wo fie so it's very advisable say e ba so be wo because of problems here yabobo so no we of health facility na ye we nyina ma na long term problems no ye wo eniema bebre ye ma mofra no and I said they make us omo my assistants ne mature ye no they have multiple problems obi o have breathing problem or better oxygen so for so long and na preterms no so omo so to say John this year ye no so ye bo hu de ru about 70% say omo benya omunya jaundice
okay
enti omo no jaundice ewo ho asphyxia wo say mframa ye de oxygen sine so ena mframa no say ye de si usu bebre a na edoso a ye free bibi retinopathy of prematurity ene say enifra nipa no obehwe no ye wo no or you okay but enam say oxygen bebre na ye de man no ama nani efra
awura nani ase it's from no
enti
I got to move to from Oko and you know akra no so kakra be fa no ho
ena jaundice no so e wo complications bebre cerebral palsy even asphyxia no so can cause that akra no betimi anyini eno nche say baby a o me preterm nyina nya so this yes betumi anya
okay
say jaundice no doso woni mojem na ebi ko wura na adwene mu a obinya bibi e friend kidney tourist wo mu a bonsa akra no obenyini no na ebi a time a so ordinance no on nante sa obi wo hono ma wanyini ebedu se obekasa na aye problem because the preterms no mo come with all these comorbidities into a mass omunyini a problems etimi ba omunyini John does not create me affect your maso enti these are some of the lifelong complications that babies need to minya. And that is why when we discharge them, omuko fear, yenja omo, ye follow up visits. Nti obi wa month biya ode no ba bechere. Said the beya ye besha akra ni nyini mu na ekosen. And as say akra no preterms no, ye hu say ye complication nti eya ye screeni omo. To say retinopathy no baby ni so na ye kokoshe say oxygen na ye de ma no and have effect bia won ani so ye yes screen any ear screen ni nyina ma omo say the bear ye be prevent those lifelong complications no. Yes.
Doctor say mamisa, when do we put these babies in incubators? That's how I'm friend incubator time I winning preterm whatever time bena mo fi say mo between the national incubator na time bena between in a free man and so on something.
Okay, into incubators no there were a lot of factors I consider and the baby be able to incubate them. First of all, a baby now a fan on weight. Usually babies are more less than 1 your friend say 1 kilogram and I say less than 1,000 grams. Among the incubate them. Ni show me na baby bu ho a omo ankasa omo ntimi generate sene na sister Aisha e kan omo ntimi generate heat ma omo ntimi uja omo a awobedi omo na omawu ti omo nso ye de omo to incubator ne ya show omo nti incubator ne ye hwe ye de nkrani tum ne ya show omo de bia e be daily way ne ya hwe sene omo sinyini fa omo nyini dru baby a omo weight na ya appreciable anase omo atimi home anase omo say later ye check omo temperature on say your normal atmospheric temperature near around 26 to 28 degrees Celsius until see far kra no na say ye de neto normal anase normal atmospheric temperature no atimi generate normal body human body temperature 37 degrees na you say oh baby radio betimi survive outside the incubator. The incubator and the some of the factors need be consider near the crana to incubator.
Obi message be I also some phone so I was say so bisa say ye can courses no. I almost say a person or a message or sending I'm trying to decode them or say so by ma almost say I was say you Google so also onyam no ne onse doc dey also o se ozu gugu so oni ni kuna eda oni be ma da na ono ne is it that oba wa ma yan gugu so na onya preterm and I think it's one of the myth and as I don't know okay maybe I want some
I think it's on the contrary because even say yamfani say time bro so panwa we even advise say obe have sexual intercourse and no boama awode na no timi biemu
so wanyema but that mu tie dey say na man's no eduru na ma
e pa ho
no say ni kunu ni tisi ni so
exactly
okay so kan be ka say hu na de ni hu ni say be am mo abi
oh say no na that time no be work not for the fun no but because you want something
for purpose and say nye fan purpose then say it's to galam so gidi
there be when galam say we only need the sperms to go in there
say be ko okay no ne ko ma okay nti de o ka say ugugusu no no na wan gugusu ana ma akwara ne say no ye no na nye sanity ugugusu no kura no ugugusu wan to bo ugugusu a enema ananya sa
there be ugugusu ye fa ne set time na so ye hwe ye no wa bro 41 and 40 weeks eko time no apa ho awo no so nka there are a lot of ways I bet me they induce labor no we natural induction
To do it on purpose.
Yes, in no you be advice so say at that time crowd or ban on feel say e be on be ma be share, but you are doing it for a purpose as you said.
I think the question here probably the first trimester, second trimester, and probably on that time.
Yes.
And it said okay, they when they be do 9 months or now. Na say Maya probably all the doctors no crowd advice.
Yes.
This is the way to go. But when one day onim I think the question I made onim she na nere anyam. And was say also gugu so. Ebi akwan 20 no ni ho. Enti ne fear ne say minu ho na magugu so. Ene say be preterm.
Oh there be. And sir.
Okay.
Enti sir. Ebi kura ne no begugu so momo na e be preterm because ebi kura timi sisa.
Be on mom too.
Ebi o ho no momo na e be preterm but only one there. Yes.
Yo so wusia de uti ni ebebo apa. How does premature birth affect a child's development and quality of life? Akwara na ya wona na wo ye preterm no. Ni development no. Doc one friend my batch on. Akwara mu ko no mo ba wi ase ko hu no ho ano.
Nti their development and quality of life no. See if preterm for na say ne e kan immediately omunya complication na sister Aisha kan ho asem no but omunyine no na ebiwa complication ni bi afina dan no ho adi bi mu they start getting respiratory complications ebiwa nkrani bi omunya na o ma sha say nya asthma ebiwa omu sha say nya bronchitis nti from time to time they may have to come to hospital and ebi mu so ho some of the preterm no they have delayed development. Say be a time I was say drew man konjina na ni konya engine time I was say drew na was so tenance no nyantenance into preterm in some aspect it may affect you in that regard. And yes into prematurity no and also it may affect in chronic in their development in those regards.
Asha similar to that I mean bisawe health complications are associated with preterm and as a premature birth complications in it.
Okay, so na doctor no because of say you almost at that time almost systems in mature immediate ones na boss no can lead to the long-term complications. Okay. Because said you make John this no cran say kodoso e won mojemu a ebetimi affect na so. Okay. Na so akra no onte. Yes, it affects their cochlear we say. And then nani ebetumi efra. Aside that obi ohono mo a said you kan no developmental milestones maybe I expect say akra by 6 months ebi also otimi tenase. And also say ebi also otimi you won't say preterm no ontimi enye sa nema but no enye complication per se because preterm no say emfa say you won 7 months na yawo 7 months ni ene na yawo 9 months ni ene omu nyina yebeka so omu birth date for a fit any date a fit right but the way you care for preterms no sa preterm no yanyam wo no temfa so 32 weeks 8 months
no bia ene 7 February or ba 7 February but want to make us any birthday no
if you dey any birthday but yeah dey
so many birthday because
that your chronological age and your corrected age
okay
ti eno no dey obedi ni birthday no because that day ni wo but hospital no ye hwe na because yem pese ye be misdiagnose bibi no we use the corrected age because ebia 9 months ni no when ya 2 months ene na 7 months ni na ye wo no ye ntimi nka so ono nso enya 2 months enti ono afi na ya wo no
afi na benya na no
afi ni ya wo no enti se ye hwe se bia we kon agina we kon engine ya na wo de ne betoto a and that is the mistakes nso a efiefo ni bebreye ye se o ni e oba no o ya asram na ye no
akora wa ba 2 months ba akora ye kapa 2 months
onyanya wo no enti so that is what we want the public to understand. Yes, we are praying no abantem na mum no the age no enyandrusa enti ebi wo ho no mo because of oxygen in the treatments na ye de ma wo mo at the early stages no obi wo benyini no cry bi wo wa cerebral palsy say them can it can be yes and yes to scare them say preterm be no some of the complications obi wo cry na mental retardation that is what is in the book. So but funny enough when you meet preterms they are doing very well. Exactly.
But me wa phobia no need dem say jo mi sasa ko say no so me bisana obo mana ni
that then is very ironical because you meet people who are preterm. Your doctors be your hospital they are preterm. People who are doing well they are preterm. Nurses obia so it's there, but then maybe God also does his things in his own ways.
Progesterone therapy and how do you use that to prevent preterm or premature birth? Doctor say
your pregnancy, your pregnancy hormones, your estrogen and progesterone. Progesterone is hormone because it maintains pregnancy. Until a due time, progesterone son. I was say usually by 40 weeks, progesterone levels not performing. It was a baby no ever. The progesterone therapy near sha ye de ma nkofo a more likely say ebia omunyin no ebe ende nti because progesterone e hormone a maintain pregnancy maintain the womb awodie na akura ni dem no progesterone hormone bia na maintain awodie no nti ye mom progesterone na e keep wound no e prevent service no from say anu bi abra time nso ti kopem say time a ye sha baby no and fetus no why well grown enough for obetimi aba.
Yeah, how we can reduce the risk in the account how we can reduce the risk any more nurses need doctors no mo so mo abe na motimi de boa se oba ready nim so we preterm pa e de mo na mo so motimi de boa ma emma.
Okay, so first of all the yebe can say regular antenatal care. Risk na dey wo ho but you who terminate me so ano yet me prevent some of these births. One of the causes of preterm birth among boso a teenage pregnancy emprewanyensen so and now obi also when you abroad 35 years or corner and also a risk factor
a man can almost free by 23 and I say
a be cancer from 19 to 34 a be so 20 to so ranges maybe but and now we in terms so
and tembe brenye age be so
because I share word cry na preterm delivery say word no e na bebre na teenagers no e na e na omo word enti I
make us a more health professionals them one mutim de boa to reduce the risk
yes.
and avoid
enti no na first antenatal care say oba na nyima ye bebo de rule say wonyima abra hospital ment na fee. Secondly, they say teenage pregnancy and also a public health consent ye bo de rule say if possible family planning usage no encourage because you can't tell them say they should abstain. If they are abstaining, that is the best. But if they are not abstaining, family planning. And so yeah, very good. And they are very good. So they be prevent teenage pregnancies no. And I feel so no. Some of the high risk no pregnancies no. Say they also yeah boy. It's yeah the end say identify say when you say a high risk. They say ebia diabetes or hypertension you refer a woman doctor not just say when you specialized care e bi wo kwa yetimi plan wo birth no say oh dear echo ninti e bia wo ba no onya 8 months e wo say ye no so the baby to save both the mother and the baby. And those are some of the things that we do. And above all, I think that Ghana your system no is not such that say onyima like before so when you move to hospital obi anyin say accident
more like we don't plan our
birth exactly. Ideally now say we prenatal counseling obi wo hono ma weight no kra wo de benyen sen enye wo lifestyle no enye ebi so you hypertensive dada or you diabetic dada so you have to see a healthcare provider now na plan it folic acid use folic acid use no e was so da so kakra ansa na why den wanye me na yenye by ade anke itimi plan a birth na I think they will be able to reduce some of these risk factors no because obi aba hospital obi san no cry say the last menses cry den they can't recall on any dey say onyim they didn't plan the birth. Yes, so we are doing a whole lot, and this advocacy now is to also educate the public. Say these are the causes. So if we can also find ways and means,
the more no November, sana minimum beat line like a crab yama achieve for Bama. What is happening in this month of November? With regards to prematurity and preterm birth.
So said you can't say prematurity no say you fat preterm birth. Osha Ghana ha leading cause of child death preterm prematurity. Over under 5 deaths are okay most no from premature babies. So you who say your concern and the need for awareness creation, advocacy. So every year, it's not only Ghana, it's worldwide. Every November has been set for Purple Month. Health providers, baby, doctors, midwives, nurses, obia, and even including community members, our queen mothers, and everybody, imams, pastors, and all that, to involve themselves in this month, so that we create awareness. Na yen met na ewofie for a dream. Say, oh, kitikiti obano or your kotre. Ebi kura or say,
they take the opportunity to
exactly
talk about the myth for me.
Yes, so until I say, ama efie communities no. Because you show me your hospital power, but you no mukofia. Na fearful no. Oh, where ya srambo de jo. Ya sramwe. As anyama can say. Physical killing. So we want to use this month to create awareness. Say, a premature birth no, it can happen to anybody. A one at a time answer. So November month a purple.
Okay.
We are going purple for our preterms to create the awareness. And every year there is a theme. That prematurity month no. And this year there is equitable care for every preterm. Say baby a bewu preterm bia. Say the shall say on say share courses no. Obi wa baby a bewu no. Enti ontimi survive. Baby a bewu preterm bia no. Also ultimate survive irrespective of when a war no baby or war and a when a share no. So with this no we have to scale up and yema be to say health providers nankasa ye trainings microphone will be the way I see share preterm and I feel so no we are using this medium to also advocate. We know that they are philanthropists because care of the preterm no it involves cost. Hospitals maybe money be a day a share preterms be to say incubator, CPAP, perfusers, machine monitors they don't have. But if you have Bameshia, if you have Benya Kakra, Obako, if you hospital be unya. Into equitable care, we are not there yet. So we are using this media to also advocate. If there are philanthropists out there who want to help with this course, you bet me donating yama bebre at the ama hospitals no. Moye underserved and said ye be drew the same level na ye said the preterm be won be no or be surviving.